I'd like to extend a warm welcome to Mike Rowson. Mike is the faculty tutor in our Faculty of Population Health Sciences. So you met Andrew Hayward last week, so he's the Institute Director, so effectively the head of the department. Mike, for all things related to education, is effectively our faculty representative, so that's the next layer up in the university hierarchy. Mike's also a specialist in global health, and he's we continue to teach, I think, Mike, in the Institute for Global Health on both their undergraduate programs and their master's programs. But Mike, I'll hand over to you.
Great.
To introduce yourself.
Yeah, thanks. Well, you might like to know that if you do end up at UCL in our Faculty of Population Health Sciences, you'll probably be at the third largest public health entity in the entire world, after Harvard School of Public Health and Johns Hopkins Bloomberg School of Public Health. We're a huge entity. Our turnover every year is £160 million. And so actually our education is a small part of that, because it's really we have about 1,200 researchers here working on all aspects of public health. And I wanted to talk to you today about one part of our faculty's efforts, which are in global health, which is an area I come from. You'll see this is titled Health and Development very boringly, but it makes a point that, first of all, and I'm sure you've heard about this in the rest of the week, that you can't isolate health from any other aspect of society. It's utterly impossible. And I speak to you as a non-health specialist. You're probably not a health specialist. I didn't learn health at university at all, but I became a lobbyist and health charity director. That was my entry into this area. And I suppose we launched degrees like population health and global health in order to get you to a stage that I was never at when I entered that job market. And it's to get you to realise how significant these issues are, and how, by having a well-rounded understanding, it gives you a really, really good entrance into all kinds of jobs in policy, advocacy, lobbying, programme management, and so on, whether it's nationally in the UK or globally, or whether it's inside the health sector or outside it, because these skills are transferable. Okay? Believe me, I've done it. So I've suddenly transferred my skills to this sector for the minute, but we want to move on. They're very flexible skills if you want to move around a bit. Okay, I wanted to just play you a short video, and this comes from a BBC programme called The Joy of Statistics. It's actually re-shown on BBC 4 at the moment. I'm sure you avidly watch BBC 4. My TV is permanently tuned to that channel. It's a very intellectual channel. And you should have a look at it. This is just a 4-minute excerpt by Professor Hans Rosling, who sadly passed away this year. Sorry, Stephen, you sort me out. He's the statistician who is going to appear in this, and it's just going to talk to you a bit about trends in global health over the past 200 years. And I want you to listen carefully to it and think about whether what he says is right. Is the world converging or diverging in terms of its health progress and economic progress? Yeah? I'm going to bring those two things together.
Visualization is right at the heart of my own work too. I teach global health. And I know having the data is not enough. I have to show it in ways people both enjoy and understand. Now, I'm going to try something I've never done before. Animating the data in real space, with a bit of technical assistance from the crew. So, here we go. First, an axis for health. Life expectancy, from 25 years to 75 years. And down here, an axis for wealth, income per person, $400, $4,000, and $40,000. So down here is poor and sick, and up here is rich and healthy. Now, I'm going to show you the world 200 years ago, in 1810. Here come all the countries. Europe brown, Asia red, Middle East green, Africa south of Sahara blue, and the Americas yellow. And the size of the country bubbles show the size of the population. And in 1810, it was pretty crowded down there, wasn't it? All countries were sick and poor. Life expectancy were below 40 in all countries. And only the UK and the Netherlands were slightly better off, but not much. And now, why start the world? The Industrial Revolution makes countries in Europe and elsewhere move away from the rest. But the colonized countries in Asia and Africa, they are stuck down there. And eventually, the Western countries get healthier and healthier. And now we slow down to show the impact of the First World War and the Spanish flu epidemic. What a catastrophe! And now I speed up through the 1920s and the 1930s. And in spite of the Great Depression, Western countries forge on towards greater wealth and health. Japan and some others try to follow, but most countries stay down here. Now, after the tragedies of the Second World War, we stop a bit to look at the world in 1948. 1948 was a great year. The war was over, Sweden topped the medal table at the Winter Olympics, and I was born. But the differences between the countries of the world was wider than ever. United States was in the front, Japan was catching up. Brazil was way behind, Iran was getting a little richer from oil, but still had short lives. And the Asian giants, China, India, Pakistan, Bangladesh and Indonesia, they were still poor and sick down here. But look what is about to happen. Here we go again. In my lifetime, former colonies gained independence, and then finally they started to get healthier and healthier and healthier. And in the 1970s, then countries in Asia and Latin America started to catch up with the Western countries. They became the emerging economies. Some in Africa follows. Some Africans were stuck in civil war and others hit by HIV. And now we can see the world today in the most up-to-date statistics. Most people today live in the middle, but there are huge differences at the same time between the best of countries and the worst of countries. And there are also huge inequalities within countries. These bubbles show country averages, but I can split them. Take China, I can split it into provinces. There goes Shanghai. It has the same wealth and health as Italy today. And there is the poor inland province Guizhou. It is like Pakistan. And if I split it further, the rural parts are like Ghana in Africa. And yet, despite the enormous disparities today, we have seen 200 years of remarkable progress. That huge historical gap between the West and the rest is now closing. We have become an entirely new converging world. And I see a clear trend into the future. With aid, trade, green technology and peace, it's fully possible that everyone can make it to the healthy, wealthy corner. Well, what you just seen in the last few minutes is a story of 200 countries shown over 200 years and beyond. It involved plotting of 120,000 numbers. Pretty neat, huh?
Great. So, he pretty clearly makes the case that this is a converging world in terms of health and wealth. Do you agree? From his own presentation. They're coming together. The different countries of the world are getting closer together in terms of their life expectancy and also in terms of their income.
Yeah, so,
Yeah, you agree?
yeah.
Yeah, I just think there's more like development in countries that are once more less developed than they are now. A lot of African countries are coming up, and Asian countries as well.
So converging because Africa and Asia is catching up. Yeah. You're all agreeing with the professor, which is very sensible. Does anyone want to stick their neck out and disagree? Based on exactly what he said in the video.
The richer countries are actually diverging.
Well, you could say within countries, he did mention there's inequalities, absolutely, and in poorer ones as well. No one's going to stick their neck out? Yeah?
I'd say you could argue that between the different regions that the level of human health is very different. You can take countries like Ghana, compared to Japan, even though they have the same length of time. Actually, the gap between the last sectors here. If you look at 1810, it was a very small gap,
Yes.
and looking at the 21st century.
Precisely. In 1810, they were all down this end of the graph, all clustered up together, rich and poor countries. But by 2010, the gap was like this. Yeah? I don't think, can I just get back to, it finishes on a final, no, I probably can't get to it, no. Yes, that's what I would say would mean that this is a diverging world. What, we can just bring that graph up again.
Try.
Can anyone think of anything he said during the...
Make it to the disparities today. We have seen.
Let's carry on with that and we'll stop it when we get to the final point. So we've got this divergence from 1810 onwards to a very, very unequal world in terms of life and health. Could you, from looking again at that graph, tell me why he's right, that it is converging? I know this is kind of trickery.
The gaps between the countries, as in overall getting smaller, but I guess the gaps between, like, the difference is getting bigger, but the gaps between them are getting smaller.
Maybe. You may actually be right. I'm not sure whether that's right or wrong, but it may be true. If we look back to maybe 1960, actually that overall gap might have got a bit closer together, especially in the health field, in life expectancy. Maybe not the wealth field. But just looking at this, he said something really crucial in the video, which may make you think, actually, yes, this is not a diverging world, it's a converging world. Where are most of the people? In the middle. That's exactly what he said. So these bubbles represent countries, don't they? But they're not all equal in size. They're weighted by population. What are the two biggest bubbles? That one and that one. Which countries? China and India. Their progress has been quite dramatically towards there, which means that most of the people of the world, because they are located in India and China, have moved upwards. In that sense, you can say the world is converging because the countries with the biggest populations have travelled the fastest towards the developed country standard. Yeah? So the simple thing actually that needs pointing out here is that when we look at this is a picture of global health inequality, yeah, and wealth inequality. But the simple thing that needs pointing out is that when we're measuring that, we could look at average income or average health in countries, or we could look at population-weighted average income and average health. And if I use two different measures, I could say the world's getting more unequal, or it's getting less equal, or more equal. Yeah? So you've got to be very careful using these statistics, and you've got to be very careful when people claim we're becoming a more unequal world. It may not be true. But let's have a look at, I wanted to use today's talk to kind of illustrate this theme about that global health, you need to bring in all the disciplines. And also just to get you questioning statistics, because you'll be doing quite a lot of statistics on this course, but we always need to keep them in context. These are the new goals, I'll put some lights on again, for the world as a whole. Has anyone ever heard of the Sustainable Development Goals that the world has to achieve by 2030? You have, okay. Did you get taught this stuff in school? You just heard about it sort of in the media and stuff like that? Andrew mentioned it. Oh, okay. Andrew mentioned it, so you have heard about it at least once. All right, so these are the 17 goals, and there's one of them that's devoted to health. But I hope you can see that many of the others, like reducing poverty, reducing hunger, are also health-related. Yeah? They will improve health as well. I just wanted to get you to think, we've had a set of international development goals before this lot were launched last year. Previous set were called the Millennium Development Goals, and they stretched to 2015. This was the target, previous target. By 2015, the developing world should have reduced the proportion of people whose income is less than $1 a day by half. Did we do that as a world?
No.
Definitely. Shall I get you to vote? Who says no? Yes. And nobody, everyone else is just hedging their bets. All right. We did it. This graph doesn't exactly show it because it's showing you only up to 2010. But what you can see is that for the developing world as a whole, we had 47% of people living on less than $1 or $1.25 a day in 1990. And actually, even by 2010, we halved that. So we met the target even earlier than predicted, okay, for the developing world. This $1.25 a day, have you heard of this before? This is the international poverty line. Yeah? When we say this, do you think, when I say $1.25 a day, am I talking about $1 in your back pocket? What am I talking about? Does anyone know this? So, do any of you do economics? Have you heard of the concept of purchasing power parity and dollar purchasing power parity? Yes? Can you explain it? It's a very difficult concept to explain easily.
So that's like the amount of spending power that you have. Because obviously the countries, there's different currencies.
Yeah.
So $1 in Poland, for example, and $1 in China can buy a different amount.
Yeah.
So if you use an indicator like PPP,
Yeah.
it reflects that.
So when we're trying to measure poverty in different countries across the world, we've got to adjust for the different standards of living between countries, yeah, like Peru and China. And so when you see that, actually, it's not very well expressed because what it should say is $1.25 PPP, or international dollars 1.25. And that means that the cost of living differentials are being netted out. So, living, what do you think it's like to live below $1.25 a day?
Horrible. Inequality, that food would be scarce,
Yeah.
living conditions would be harsh,
Yeah.
Education would be limited.
Excellent, yeah, absolutely. The World Bank says that living below this amount of money per day is living beneath any reasonable definition of human decency. How many people in the world live below this? Loads. Yes. Can you quantify that?
More than half.
Huh?
More than half.
No, it's not. That's too much. Too much. So, quarter. No, that's too much.
15.
It's probably about an eighth. I'm not working in that sense, but I'm working in absolute numbers. Shall we get to? I'll show you what the number is at the moment. Here we go. Poverty statistics take a long while to collect and analyse. So the latest data that we actually have is from 2012, and in that year, 902 million of the world's 7 billion population, so that's about a seventh, lived below. Now, do you see there's something else? I don't know if it shows you on this graph. Yes. The poverty line has now gone up to $1.9 a day at purchasing power parity. Can any economist tell me why the absolute poverty line may have changed from $1 to 1.25? Inflation, exactly. What we know now is that prices in developing countries have been rising as economic growth occurs. So the international poverty line has got to go up with it. So that's why. So this is the new international poverty line, although you'll see it expressed in all kinds of different ways. The numbers living under that line basically stay the same as they were in the uninflated line. So it's 900, and the projection was we'd be down to 700 million by about now, which represents 10% of the world's population. Yeah?
Did we reach that?
I think broadly, yes. I think the latest statistics say we are around 700 million now. The goal for 2030, though, is not to halve this number, living on under $1.9 a day. It's to eradicate it. Was that a scoff or a hiccup? What do you think? Do you think we can do it? No. Can I just point out something to you? Can you look at this graph? The poverty rate is being murdered. Well, the absolute numbers living in poverty. Look at it. When does this start? 1990. How long is it going to take to get to zero?
8
Ages. Yeah. Well, actually, let's see. What do you believe, economists?
No.
Okay, well, I'll never convince you of anything then. All right. Will it happen by 2030? Let's have a look. This is what the World Bank, which is an institution stuffed with double PhD economists, think is going to happen by 2030. And obviously, it depends on rates of economic growth, and you could change those. But if you think of quite a fast rate of economic growth, around 4%, they actually say that by 2030, we will have got down from 10% of the world's population living on less than $1.9 a day to 3%. Okay? It won't be zero, but it won't be far. And surely that's right, isn't it? If this is a level beneath which no human being should live because it violates essential concepts of dignity, the world as a whole must do this, mustn't it? We've got to do it, isn't it? No ifs, no buts, isn't that right? All right, I want to go back one step. I'm not going to show you all these slides, by the way. I just want to pick out a few things. If we go back to the Millennium Development Goals, yeah? And we split the developing world up into two of its different regions, yeah? Not all of them. Latin America's not there, the Middle East isn't there. Don't care about them for the minute. We have China, basically, Eastern Asia, which is basically one country, China. Remember, we're talking about the developing world. Japan is not developing world, so it doesn't get included in these figures. And we have Sub-Saharan Africa. Do you see what happened? This is the target. If we impose this 50% reduction target on the region, what has China done? It's achieved it big time, hasn't it? Way in advance. This is by 2010, it's got down, so it had 60% of its 1.3 billion population were living under the international poverty line in 1990. By 2010, 20 years later, we got down to 12% of its 1.3 billion population. That is a reduction in poverty unprecedented in human history. What about Sub-Saharan Africa? Nowhere near meeting the target, this 50% reduction target over the 1990 baseline. Way off, reduction of 10 percentage points. Yeah? If we're thinking about the developing world as a whole then, how has the developing world as a whole achieved its target by 2010?
Just under half.
It has. I'm just asking how. How did it get there?
Is it because I guess people were more aware of it afterwards and then they were doing more stuff about it?
Yeah.
But one thing I noticed about Sub-Saharan Africa is there's a lot of corruption there. Like I was in Malawi and we were trying to do like little stuff there. Yeah. And even like the charge of the building was literally going under corruption. Like literally just like the head teachers would just take it off to like the little kids. Like something so simple like that. Yeah. So I noticed that there was a lot of corruption in Africa.
Is there no corruption in China?
I'm guessing there is, but people are like.
What we know there is, there may be different types of corruption. That's the interesting thing about global health. But coming back to this, just briefly, isn't it the Chinese that have done it for the world as a whole?
Pretty much. Because
they represent 1.3 billion of the people. Remember this population-weighted concept we introduced before? So when the United Nations says we can end poverty by 2015, who's we?
China.
Yes. Do you think that's what they meant when they put that slogan up there?
Probably.
I don't think they did. You know what? I think they meant us. I think they meant the rich world can give aid to poor countries, and that can help them end poverty. Or they might have meant, because it is the international community, the world as a whole and all its governments. But in this case, it's actually the actions of the Chinese government which have made a huge contribution to the developing world as a whole reaching its target. Other countries did similarly. China can't be held responsible entirely. The world as a whole might have met the target, even without China. But it's still, yes, but this is significant. Something I want to impress on you, and maybe to tell you that this subject is entirely political. Because when we see words like "we can end world poverty," the assumption that we make in the rich country is that it's our actions which can make a difference to them. But I can tell you now, and the statistics prove it, that the reality is it's them making the difference, not us. China was not receiving aid. They did it off their own backs through brilliant economic policy making. The amounts of aid they were getting were minute in comparison to the total size of their economy. Malawi, on the other hand, is an extraordinarily aid-dependent country, like much of sub-Saharan Africa. But look at rates of progress. Does this mean aid is a block on poverty reduction rather than its solution? Oh, it's amazing how I can quickly get you to the... There may be an argument here, but there may be many things influencing it. And I want you to think about Africa for a minute, because you've said corruption, and I think that's really important and true. Are there any other things that might have meant that Africa didn't develop as fast as East Asia? Yeah.
So you could argue that in the late 20th century, there was a accelerated rate of like globalization. So, but that's a different rate. You compare it was like a shift from the western to eastern side of the road in manufacturing. But countries in sub-Saharan Africa, most of them are landlocked. Yeah. And they couldn't really. Good. They couldn't benefit.
Geography was a big. Malawi, totally landlocked. Yeah. You just think about Malawi. I mean, it's this thin country with a lake in the middle, trapped between Zambia and Mozambique. No, I get my geography right. Zambia's on one side. Mozambique is on the other side, yes. I've actually been there, I remember this. It's no coast. No one, you can't trade out. You have to have, are there good overland links from Malawi to the coast? No. So there's a real problem here for those countries. Will they ever develop? So that's a problem. You said globalization. This is how China prospered, yes? Because where do the clothes on your back come from? There they go. I'm going to test you now. They did. Bangladesh, yes, absolutely. Bangladesh has actually succeeded. Why did Bangladesh now become our preferred source of clothes? Because they're cheaper, good, you're thinking like communists. And why are the clothes cheaper from Bangladesh than from China? Because wages are now lower in Bangladesh. Yeah? When you're producing clothes and textiles, do you think you need lots of people or lots of technology to do that? People, yeah, you're absolutely right. So if you imagine China in this period was exploiting its low wages and producing world's clothing, toys, cheap consumer goods, yeah? Absolutely everything. And it was employing lots of people in doing so. This is what reduced poverty. Yeah? They were exploiting what economists call their comparative advantage in labour-intensive, low-wage services. Now, Sub-Saharan Africa didn't get the opportunity to do that, partly because China was already in the market with low wages. Yeah? But partly also because of bad governance, because of the accidents of geography. Any other things you know about Sub-Saharan Africa that were affecting it during this period of time? Drought and famine, particularly in the Horn of Africa, Somalia, Ethiopia. Is it HIV? Yes, especially in southern Africa. And that particularly affects the adult working age population, so it's going to be miserable for economic growth.
Also, if you take Black War, there's quite a few civil wars like in Sudan.
Yes. Yeah, civil wars, absolutely. So all of these things are going to be playing into the lower rate of poverty reduction vis-à-vis China. There's one other thing I want to point out from this graph, though. How do you think the world as a whole set this target of halving the world's poverty rate from 1990 to 2015? Did they just pluck that number or that percentage out of thin air? How would you, if you were going to set a target for the world as a whole for the next 20 years, on what basis would you do it?
Development rate?
Yes, the historical development rate. And that's what they did. They looked back to 1960 and said, well, by 1990, the world had halved poverty. Maybe we can do it a bit faster in the next 25 years, so let's try and do it. Yeah. But that target was for the world as a whole, calculated on the basis of world historical rates. Why then is the United Nations imposing a target calculated on the basis of world historical rates onto individual countries and regions who might not have had those historical rates in the past, like sub-Saharan Africa?
Large populations.
Well, it doesn't matter. Why is it legitimate? If you based on your previous targeting on world historical rates, shouldn't they have a regional or a national historical rate? What this graph does, is basically generate this sense of utter failure in Africa. But the target should never have been imposed. In fact, one of the designers of the Millennium Development Goals said the UN should not have done this. So be very careful when you think about targets and statistics, because they can distort our vision of reality. If you think about this idea of population weighted and the growth in income, where do you think most of the world's poor people live today? It looks like it, doesn't it? But China and India have over 1.something billion people each, yes? What's the population of the whole of sub-Saharan Africa? It's a bit over 1 billion now. It's a bit over 1 billion. But there are more people living still on under the $1.9 a day line in China and India than there are in the entirety of sub-Saharan Africa. Because those countries' average incomes have moved to the middle of the distribution, but there are still lots of poor people because of inequality. And because they're very big and heavily populated countries. So where should countries like Britain, just assuming that aid does something to reduce poverty, where should Britain be giving its aid? China and India. Where have we cut off our aid to? China and India. Do you know what the Indian government said when we did that? It said, fine, your aid is actually a small portion of our total economy. Go away. And you're the imperialist power who used to run us. We want to say goodbye. India then makes a nuclear bomb, launches a space rocket. What is it doing about the 300 million poor people within its own borders? What do you think we should do in that circumstance? Yeah. There's not much we can do because the Indian government is sovereign. It can say, sod off. Yeah. But it's a really difficult dilemma, isn't it? Now, most of the world's poorest people are in countries which are on average quite rich. It's a very difficult message to sell to the public as well. The most easy message to sell to the public is Africa is poor, let's give our money there. Yeah? So, all right, can I want to play around with statistics a bit more, but I'm going to do it directly in the health field. But do you get my sense of why you have to be sceptical about statistics a bit in this area? All right, let's do health. Oh, I know, I actually wanted to show you, I think this is totally shocking. Okay, this particular table, I know it's a bit of information to digest. India, like China, has been really growing fast economically, hasn't it? Bangladesh has also been growing fast economically, but it's much poorer than India. But if we think about Poverty not just about income, but lacking education, lacking health, lacking water and sanitation. What we can see from this table is that India is doing, a much richer country, is doing much worse on those indicators than Bangladesh. Particularly, I wanted to point out the proportion of children who are fully immunised. Bangladesh, still a large country, 130, 140 million people, manages to get 82% of its children immunised. India, it's 44%. India is at the African average. Telling that to Indians, you don't get good reception. I can tell you. The top one, which is possibly the most striking to you, is the proportion of Indian households engaged in open defecation, particularly in the rural areas, because there are no toilets. People go to the fields. But Bangladesh, a much poorer country with also a rural population, very sizable, has got that down to 8.4%.
Could it be because of the population size? Because India is so big compared to
But Bangladesh is also very big and much poorer, and we could compare it with China. I can tell you that open defecation rate in China is at Bangladeshi levels.
Oh.
So if you want to compare population sizes, India hasn't done it. They have not paid systematic attention to crucial aspects of human development like immunising children and providing clean water and sanitation to the poorest people, particularly in the most marginalised states of India, despite India having an economic miracle over the past 20 years. Shining India is what the President likes to talk about. Absolutely. Probably got these figures are a bit out of date, but only now, this year, has India launched a new campaign against open defecation. But it's very difficult. I mean, it's a kind of, it can easily be, let's blame the individuals for doing it. It's totally their circumstance. They have no choice. So I get quite passionate about that. Good health and well-being. There is a campaign for toilets. There's a World Toilet Campaign. You should go and join it. It's very important. All right. Now, these are the goals we have for 2030. There's a huge list of health goals here because there are lots of diseases and conditions, and issues under health. But I just wanted you to look at the second one down, which was end preventable deaths of newborns and children under 5 years old. That's like eliminate world poverty of living people under 1.25 dollar a day. That's a major achievement if we do that. It's an absolute goal because isn't it a scandal that children die of preventable conditions? Things we can prevent through immunisations, clean water. Actually, what do children die of? Let's look at some statistics. These were the MDG goals. We had to reduce child mortality by 2/3, very large, maternal mortality by 3/4, halt and reverse the spread of HIV, malaria and TB. Thinking about just this goal 4, what are children dying of in poor countries? Lack of clean water, yes, which leads them to get washed. Disease and also become malnourished because there's this what we call an infection malnutrition dyad. If you're infected with something, you become malnourished. If you're malnourished, you're more susceptible to infection. Lots of people who are malnourished as well. It leads them to get diarrhea. It leads them to become infected with particular diseases. Can anyone think what those might be? Malaria in tropical regions. Not all over the world is tropical, but it is an important problem. Measles, things like that. And something maybe people don't think about a lot is acute respiratory infections. Children dying of cough. This is why it is utterly scandalous that we don't prevent these. Does anyone know how you prevent cough? Or can I rephrase that? Does anyone know how you treat cough? Simple antibiotic. How do you deal with measles? Immunisation, you immunise children, don't you? One other thing as a major killer of children is, diarrhoea. How do you prevent diarrhoea? Clean water and sanitation. In countries where they don't have access to sewage systems, but people can get some clean water in, what can you use to stop diarrhoea, to treat it? Has anyone heard of oral rehydration solution? It's a sugar, salt mixture. It was invented in Bangladesh in the 1970s, not a rich country. The Bangladeshis invented it. And sachets cost nothing. And this can easily treat diarrhea and stop it. Really simple and cheap. Like the antibiotics that treat acute respiratory infections. Cheap, like the immunisations that are provided, usually by international donors in the worst affected countries. But there's a more expensive problem that's killing children. Anyone think what it might be? At birth, especially in the poorest countries, where you don't have health systems to pick up birth complications, this is dangerous for both mothers and newborn children. So a lot of child deaths are concentrated in the first 28 days, where you don't have sophisticated health systems to deal with complications around birth. That needs a health system. All right, an economics lesson. Do you remember I talked about labour-intensive services that use more labour relative to technology? Is a health service using more labour relative to technology? Yes, because the answer is yes. It may be changing, but are robots going to replace doctors and nurses? You say never, but it may be in some surgical techniques. It's possible. But mostly no. This is a very labour-intensive service. Yeah. So in poor countries, are wages higher or lower than in rich countries? Lower. So actually, you could afford, even if you're a poor country, to roll out some kind of healthcare, not much more than basic, if your government chooses to do so. If it chooses maybe to devote more resources to health than the military, for example. Because you can deliver services which are in some way commensurate with your level of income. It will not employ all the doctors and nurses that we have in rich countries. There are vast shortages of those in poor countries. But poor countries make do by training health professionals less. Sometimes they can deliver the same standards of care, even though they're trained less, and we're learning lessons from them. Actually, we're starting to employ doctors who are trained for 3 years. They're not called doctors, they're called kind of paraphysicians. So it's, there are ways in which poor countries can do it if they choose. Partly because the interventions to prevent child deaths are really cheap. And partly because if you've got government commitment to roll out health services, you can do it. There's another major preventer of child mortality in the world. The single most important underlying factor in explaining differences in child mortality. We haven't got it yet. It's not food. It's not contraception. There are, contraception and food are really important. Food for malnourishment, contraception because it delays when you're giving so many births. And if you have more births, the rates of child mortality get higher because there's more dangers for women and children from multiple births. Yeah, you're not wrong, but there's this underlying factor. Where are the feminists in this audience? Okay, good. Have I given you a clue? What might be another big underlying factor? Women's education. Yes. How does women's education improve the health of their children? They will look after themselves and their children through being able to process health-related information. If you are literate, you can do that. If you're illiterate, you can't. And rates of illiteracy are sky high in some of these countries. Female illiteracy. How else might female education of mothers, translate into better health of their children? Not just through processing health-related information. Is there another route through which education can impact on health of children?
Why don't they then teach their children as they grow up?
But you could say that's about the information. That's about being literate. You've got to think of another thing, that being educated gives you the opportunity to do, which can then improve the health of children.
Go to work.
Go to work. Studies show that women devote more of their independently earned income, if they have access to the labour market, and they can do that through being educated, partly, than men do. Survey around the world, everywhere around the world, shows that men devote less of their income to care of children and care of the household than women do. So if women are educated and can earn an income, then they can improve the health of children as well. Okay. Oof. Oh, it's nearly 2 o'clock. So I think I've given quite a lot of all the messages that I wanted to give in this lecture. So I don't want to detain you too much longer, but I do want to say, apart from talking about the fiddles around statistics that go on, and thinking about the meaning of them, I think probably what the child mortality example shows you, that by considering health services and what types of health services you need to prevent child death, but also thinking about the underlying determinants, like education, you get the picture that doing global health is not simply about giving medicines. It's about doing all kinds of other things. We could have talked, for example, in relation to education of women, of why women weren't educated in the first place. Oh, let's just get into school. Oh no. Why, in some countries, are women prevented from going to school? That means engaging with culture, religion, political governance. That means you have to bring in anthropology, political science, religious studies. So global health, like population health, is a truly interdisciplinary subject. And I suppose that would be my strongest recommendation for actually studying this stuff, because you get to study so much. I think that's all I want to say. Hope you think about coming to the